Dear friends, colleagues, Hemophilia fellows, hello and welcome to this year's EHC Satellite Symposium. It's an absolute pleasure to be taking the time to speak with you today. Please note that this seminar has been organized and funded by Bayer. By way of introduction, my name is Renato. I am someone who has hemophilia A, and I will provide you with more information on my background a little later on. In the meantime, I'm really pleased to say that we have a packed agenda for you today with some hemophilia experts joining us. I'll be handing over to Eric Berntorp in a moment, who is professor in hematology and coagulation disorders at Lund University in Sweden. Eric will be talking about some of the evidence behind optimizing prophylaxis treatment in hemophilia A. Then Barbara Faganel Kotnik from the University Children's Hospital in Ljubljana, Slovenia, will discuss the WAPPS as a tool for prophylaxis individualization in hemophilia A. I'll then spend a few moments talking about my personal journey with myWAPPS. In addition, Bayer have asked me to speak briefly on the Aim Higher initiative and their Hemophilia Awards program, or BHAP. Finally, there will be a little time for questions at the end. Please note that Barbara, unfortunately, will not be available for this, so it will be Eric and I. Please submit questions as we go along, and please accept our apologies if we don't get to answer all your questions. That's all from me, so without further ado, I'll hand it over to Eric, who we recorded earlier.
Thank you very much, Renato, for inviting me to this very interesting and, in fact, important symposium. I'm going to discuss optimizing prophylaxis in hemophilia A, the ups and downs of treatment. The overall goal of hemophilia A treatment is to provide patients with a normal life as much as possible by preventing and treating bleeds, minimizing the risk of long-term complications associated with joint damage, and improving quality of life while minimizing treatment burden. In general, the higher the factor VIII levels at all times, the less the bleeding. When baseline factor VIII levels are above 15%, spontaneous bleeding is uncommon. However, this approach, based only on trough levels, does not take into account inter- and intra-individual physiological variability or variable patient needs, for example, physical activity, lifestyle, and joint status. There is increased recognition of the need to individualize therapy and maintain factor VIII at optimal levels rather than above a minimal threshold. Pharmacokinetic parameters, such as the time spent in a therapeutic window between trough and peak thresholds, are now considered as important concepts for providing adequate protection to patients in relation to their preferred lifestyle and daily physical activities. So in the figure here, we see factor VIII levels on the y-axis and time in days on the x-axis. The blue curves are extended half-life factor VIII and green curve standard half-life factor VIII. You can see the peaks and troughs, and the therapeutic window is indicated. In contrast to this, the non-factor replacement, NFR, gives a fixed level and peaks and troughs are lacking. So you cannot individualize in the same way as with factor VIII. Can we distinguish between prophylactic factor VIII treatments? Yes, standard half-life products have been reported to differ in terms of pharmacokinetic parameters. Extended half-life products have been manufactured to have better pharmacokinetic properties than standard half-life products. Differences in pharmacokinetic parameters have been reported between extended half-life products compared in head-to-head crossover clinical trials. Extended half-life products may allow for better protection with less frequent infusions versus standard half-life products. And this is clearly shown in this slide, where the blue columns depict extended half-life products and green standard half-life products. You have different thresholds for factor VIII on the y-axis in units per deciliter, going from 1 up to 60 units per deciliter. And you have percent of time per week when you can reach this threshold with different types of products. If we, for example, look at 15 units per deciliter, you can see that 58% of the time you reach this with extended half-life products, whereas with standard half-life products, you are there only for 36% of the time. And for 20%, for example, 50% of the time, you are reaching this threshold or above this threshold, but only 30% with standard half-life products. Higher factor VIII levels are required as the physical risk of injury and bleeding increases. So factor VIII prophylaxis can be tailored to provide patients with elevated levels when they need them. In contrast, non-replacement therapies cannot be tailored to meet the physical needs of patients. Non-replacement therapies can only be used to perform low to moderate risk activities. So if we look here at the factor VIII curve with different levels and time, you have a target factor level of 15 to 30% needed when performing intensive physical activity. The target factor level is 5 to 15% performing higher risk activity, and the target level is 3 to 5% when performing mild activity. In summary, prophylaxis treatment with factor VIII must be individualized with a focus on maintaining factor VIII at optimal levels rather than above a minimal threshold. Factor VIII prophylaxis can be tailored to provide patients with elevated levels when they need them, and the elevated levels are required to achieve fewer bleeds, treat target joints, and provide protection for moderate to high risk activities. Non-replacement treatments cannot be individualized to meet patients' needs. And with that, I thank you for your attention.
Thank you, Eric, for that interesting presentation. And now over to Barbara Faganel Kotnik, who will discuss WAPPS in relation to hemophilia management. Please note that Barbara is pre-recorded, and so she won't be able to answer any questions.
Dear audience, it is a great pleasure for me to be able to present WAPPS usage in individualization of prophylaxis in patients with hemophilia. These are my disclosures. Prophylaxis, the mainstay of treatment in patients with hemophilia, should be individualized. So IT tools and mobile application can help inform doctors and their patients regarding the optimal personalized treatments. They can help patients and their parents consider estimated factor levels when making activity decisions, and they can help the doctors to optimize education process, as well as optimize coverage for patients' lifestyle and physical activities. WAPPS Hema platform, which is presented on this slide in front of you, was founded at McMaster University in Canada. So hematologists from any treatment center can register their center and include their patients for PK estimation. As first step, data on the specific coagulation disorder, general characteristics of the patients, including body weight, body height, as well as treatment data and factor infusions for PK evaluations are filled in. So after sending the request, the PK estimation presented as curve or numerically is sent back to you in the next few hours. The estimation of factor half-life, time to 5%, time to 2%, as well as time for 1% is given, as well as factor concentration estimation for each day during the whole week. This estimation then serves for calculation of the most effective prophylactic regimen when desired dose, trough, and or infusion interval is chosen by treating hematologist. Always 2 of the 3 parameters should be provided, either dose and trough, dose and infusion interval, or trough and infusion interval. The optimal prophylactic option is then presented in curve with factor concentration in time, where the line with hollow points shows the measured concentration used to estimate the PK profile for the patient, and the solid line showing the predicted PK profile for the stimulated treatment plan. The optimal prophylactic regimen is presented also in table below with peak and trough level, as well as time above 1%, 3%, and 15%. Next, treatment plan is confirmed after explaining it to the patient. If patient agrees, myWAPPS app is activated in a very easy process only by entering patient's email. Patient then receives instructions for activation of the app and can use it after on. So patients with hemophilia are then able to study their real-time factor levels, which are expressed in bars or in numbers or by curves, and they can check their scheduled treatment plan. They're also able to record infusions and further monitor the real-time factor level and treatment plan after each infusion. Additionally, a dashboard is available for hematologists who can track treatment on their patient data on daily basis, and they can monitor treatment through different time points. They're able to estimate compliance, number of bleeds, as well as factor VIII consumption. With that, hematologist, for example, is able to detect that provided regimen is not adapted to patient physical activities, and he can contact his patient and not wait for the scheduled visit in the outpatient clinic to adapt this regimen to patient's needs. And before I thank you for your attention, I would like to share with you the experience of my patient, who says that he has been using the app for a few months now. He thinks that it works without a problem, that it's transparent, simple, as well as minimalist. He found it of great help in the recording factor application because sometimes it is possible to mix up the dates of applications a little bit. And with the help of the app, this is almost no longer possible, to his opinion. And he also finds it a little easier to imagine how his factor VIII levels are decreasing after each application. So again, thank you for your attention, and goodbye.
Thank you so much, Barbara, for taking the time to record that very interesting presentation. I would like to take a few moments to speak to you about what myWAPPS means to me as a person with hemophilia A. I couldn't wait to start with it because dosing reports in my country are still old-fashioned, based on Excel forms, and are not very useful and easily available. Let me tell you a little about myself. I am 43 years old with severe hemophilia A. I am on prophylaxis every other day, which equates to 4,000 international units of factor 8, standard half-life, with a factor level of 84% from dosing to only 2% after 48 hours. But this is not a problem anymore because now I know my factor level all the time. Now, of course, before starting to use myWAPPS, I needed to take a pharmacokinetic test. But now I record all my infusions with the date, time, and dosing. There is also a reminder inside the app for my next scheduled infusion, and I receive notifications when my factor level drops to the low zone. The app is also extremely user-friendly. It is so important to me that I have my factor 8 level under control during any unpredictable situation, and on that basis I can make further decisions about extra dosing and my current active life activities. Let me show you my recent summer calendar on myWAPPS. In July, you can see all those green spots are my factor 8 applications. That means my adherence was excellent thanks to the app. I assure you that without the app in the past, the consistency, for example, dose and time of taking my treatment were not as accurate. On July 11th, I hope you can see a small yellow spot. It means there is an additional note. In my case, there was a blood pressure measurement, which I felt was important to record, so I did. And if you are wondering why there was an additional factor application on July 22nd, this was not due to bleeding, but because of my mountain biking. My factor 8 level at that time was 9%, so an additional dose was necessary for my activities on that day. As a hemophilia advocate, I am constantly striving for new ideas and solutions for our bleeding disorder community. That is why I'm asking myself, what more can we do with this app? If you ask me, can you now make more informed decisions? Can you now better self-manage your condition? Do you now have a reliable partner for your hemophilia management? All my three answers are definitely yes, because my smartphone partner helps me much more than I expected. You have been listening for several minutes now about my experiences and views on the myWAPPS app. What about other hemophiliacs? I would love to hear more about your experiences. Also, please let me know if you need any more help or assistance. I would love to help if I can. I hope you can now feel empowered by the story of a completely ordinary hemophiliac who fights for the quality of life of all his friends and colleagues with bleeding disorders and who started a very arduous journey called the Hemophilia Mission. I have lived in the past without sufficient factor 8 coverage for a long time, without the internet, and therefore without sufficient information about my illness, and without smartphone applications to help me manage my treatment. So my hope is to have an active second half of my life with hemophilia with these tools. And I want the same to all of you. Aim higher, my dear hemophilia fellows. Aim higher every single day. That is one of my favorite health mottos. Despite the COVID-19 pandemic, this summer has been my most active to date. Cycling, canoeing, swimming, go-karting, Nordic walking, nature trips, and working at home with my parents on the farm. Yes, it is possible despite my 3 severe and 2 moderate hemophilic arthropathy joints. As you have probably already noticed, we just moved on to our section called Aim Higher. Aim Higher is a campaign concept that was developed together with experienced people with hemophilia who are part of Bayer Hemophilia Patient Council. Together, we have begun by reaching out to people with hemophilia via social media and a website. The project uses stories of real patients like Ivan and Loek to show what they have done to aim higher. Evan says playing sports with his friends is great for his physical and mental well-being. So there could be factor VIII treatments available to him that are more suited to his goals that may help him to aim higher. On the other hand, we have Loek, who is not a sportsman. His story is a bit different. He found himself skipping doses because he found managing his dosing schedule too difficult. There was a solution for both of them, and there could be a solution for you too, my hemophilia friends. However, the Aim Higher campaign isn't just about the stories of hemophiliacs, but about raising awareness and presenting ways and tips on how to personalize factor VIII therapy according to your wishes and needs. Hemophilia stories are just a way to get further information or answers. So to help you aim higher, here is, for example, a checklist of 8 important things to discuss at your next appointment with your hematologist. Keep a record of how many bleeds you have had in the past 12 months. This is very important information that will help your doctor to understand whether your treatment is optimized for you. Make sure your doctor is mindful of any hospitalizations when they are evaluating how well your current therapy is working for you. Think about how comfortable you feel participating in physical activities on your current treatment. Are you happy with your current dosing frequency? Do you ever find yourself skipping doses or your current treatment? How satisfied are you with your current treatment? How would treatment changes improve your life or make managing your hemophilia easier? Would I benefit from changing my factor VIII therapy? The main thing is you have the power to define what you really need. A recent study named MOTI-8 highlighted that besides effective hemophilia A treatment, information, education, and communication are key triggers to help people with hemophilia and their parents to live a normal, active life and to feel unrestricted by their disease. You and I know of many people with hemophilia who have become great success stories. But do you agree that there is still a long way to go and that we have not yet managed to reach everybody, that not every people with hemophilia is living the life they want to lead? That is why we also need your experience, your ideas and engagement to bring this campaign to life. To enhance our campaign in a way that is relevant and engages all people with hemophilia and helps them to aim higher. Aim higher, ladies and gentlemen, because life is what you make of it. Finally, Bayer have asked me to present 1 or 2 slides on their Hemophilia Awards program, or BHAP. The purpose of the program is to support clinical research and education in hemophilia. It has done this by providing grants and training to those who provide care and treatment options for people with hemophilia. Submissions are now open. There are now 4 different awards currently available. The awards offer treaters, researchers, and young clinicians working in hemostasis and hemophilia with various options tailored to their aspirations and career backgrounds. However, this year includes a new Patient Engagement Award, which will provide funds to support efforts in the field of patient engagement, education, and advocacy in hemophilia. This award is to recognize the essential role of nurses, allied healthcare professionals, and caregivers in the care of patients with hemophilia. Please type BHAP hemophilia in your search engine for more information, or go to BayerHemophiliaAwards.com. Deadline for submissions is November 30, 2021.